Hello, and welcome to the Doctor's Inn. I'm Marcia Boyles, and as usual, I'd like to introduce the star of this show. This is Dr. Kamaljit, who is one of the primary care physicians at the medical center. Dr. Sethi, I think we have a particularly relevant topic this morning. We're going to be talking about UTIs. Where would you like to begin?
We can start wherever you want, Marcia, but maybe a useful place to start today is by talking about the cost of urinary tract infections. You know, there's so much talk about how we should pay for our medical care. Mm-hmm. So while urinary tract infections seem very ordinary, they're the commonest infection.
They are?
They are. They can be very costly. Most people are inclined to think that the cost of urinary tract infection, other than the individual who's got the problem, the suffering, is the cost of an antibiotic. That is overly simplistic because ordinary urinary tract infections can cause significant morbidity when people have symptoms for days. But urinary tract infections can be uncomplicated or they can become complicated. And when they do, they may even require hospitalization. And then the cost is really contingent on those complications and can range anywhere from $13,000 up to $30,000. So whoa. I think that when we think about urinary tract infections, we should think of them as causing considerable morbidity and to have serious consequences for what happens to us. So I think that's a useful place to start. I would like to say that I'd like for us to focus on three areas because urinary tract infections are a very broad topic. And I'd like for us to focus our attention somewhat on three areas, and we'll touch on the others. And they are, who is at the greatest risk? And the second is, if we know who is at the greatest risk, what can those individuals and everybody else do to prevent urinary tract infections, because they are preventable not 100%, but to a very major degree. And then lastly, we can talk about treatment. Treatment usually is not that difficult. What we really should aim to do with urinary tract infection, this is one message I hope to leave people with, is that they are mostly preventable.
Okay.
So having said that, we should say we use the word urinary tract infection very broadly to include infections of the bladder and the kidneys. So what we commonly refer to as UTI is a bladder infection. And most bladder infections are very easy to treat. If there are kidney infections, they're potentially more serious. But we tend to lump them all together. But as we speak about them, you know, we're just speaking about bladder infections, you know, principally. It'll come as no surprise to anybody here that the biggest demographic group for urinary tract infections is women. Excuse me, and older women. And as many as 50% of women will have an infection in their lifetime.
So as we age, the likelihood of getting a urinary tract infection increases?
It does, it does. And there are many reasons why women get more urinary tract infections than men. In men, it is an uncommon problem. In women, it's a very common problem. So amongst the reasons that women get more infections, there are multiple layers here. There is the anatomy, the female anatomy being different, then there are physiologic reasons, and then the one that is shared by men and women are the clinical comorbidities. So let's talk about the anatomic part. Very easy to understand. Women have a very short urinary passage, and therefore the potential for bacteria to enter and cause bladder infection.
From the outside?
From the outside. The physiologic reasons are also not difficult to understand. In the childbearing years, related to sexual activity, there can be an increase in urinary tract infections. And then as we get older, because the muscles, like the rest of us, age, and so they don't maintain bladder tone as well. There's laxity of the muscles. And so that may also permit entry of bacteria.
Okay.
The clinical, so those two are particularly for, more so for women. The clinical comorbidities are shared, but tend to be a bigger problem again for women. And they include having a disturbance in immunity. So for instance, if somebody has cancer, they're more likely to get infections anywhere because their immune status is lowered. Diabetics, and we'll touch on that a little bit more later, but it's a recurring theme because diabetics, because of the high blood sugar, tend to get more infections anyway. Their immunity is altered, they have disturbances with their bladder. And that gets us immediately into the next one, which is incomplete bladder emptying. Now, this is not often talked about in relation to urinary tract infections, but here's the scoop. So if you're experiencing having to go to the bathroom very frequently, you've already been, and then you feel like, again, 10 minutes later you have to go, 15 minutes later you have to go, it may mean that you are unable to empty your bladder fully. And there can be reasons for that. We won't belabor those now in the interest of time. But if there is incomplete bladder emptying, practically speaking, what it means is when you've been to the bathroom, the bladder is no longer empty. Men are able to empty their bladder fully. Women can retain, even normally, about 2 ounces of urine in the bladder. So when the urine sits around in the bladder, particularly if it's not emptying fully, instead of being 2 ounces, it may be 6 or it may be more. So whenever you let anything sit for a while, it's likely to get infected. When urine sits around for a while, its normal pH, which is acidic, now becomes alkaline. And when it's alkaline, that promotes bacterial growth. So incomplete bladder emptying.
Would an individual be aware that their bladder had not been emptied?
So as I said, if after an individual has been to the bathroom and they find they have to go again after 5 minutes, we know that the bladder didn't fill up after 5 minutes. That's one sign. So that's something to discuss with your doctor. So there may be reasons why the bladder doesn't empty fully. It may be because there's there is prostatic enlargement if it's a man, or if it's a woman, there may be prolapse. Prolapse of the bladder. That just simply means the bladder normally is sitting upright like this, and when there's prolapse, because of the weakness of the walls, it sort of falls back. When it falls back, it doesn't empty as easily, and some urine may sort of sit in it. So those may be circumstances where we need, for women, a urogynecologist, because they can determine if there is a prolapse and do what are called urodynamic studies to see how easily is the bladder emptying. Urologists also do that kind of study when the
Is there a cure for prolapse?
Yes, of course there's a cure for prolapse. So the cure for prolapse is, the first and foremost, are the use of Kegel exercises to strengthen the, it's not going to make the prolapse go away, it's going to make the muscle stronger.
All right.
Sometimes they can use a pessary, other times they may recommend surgery. And for the prostate, of course, again, then they give medicines which will improve the urinary flow, which helps you empty the bladder. And then if, there are other reasons, there may be an indication to do remove the prostate. And these days, those surgical procedures are much easier than they were in the past and require much shorter stays, if at all, So those are two areas: the incomplete emptying of the bladder, meaning you have to go to the bathroom often, or if you have incontinence. Now, if you have incontinence, it doesn't matter, man or woman, but more so for women. If you have incontinence, it doesn't matter what the incontinence is from, but then you have to be particularly attentive to personal hygiene. Okay. So it's like, with a baby, you don't want them to have a wet diaper. So you don't want wetness in that area, because the longer it stays that way, there is a risk that there can be bacterial growth. And so there are ways to deal with that, and there just has to be meticulous attention to personal hygiene, i.e. Cleaning, using water or using cleansing cloths every single time, 100% of the time, and that can help mitigate the frequency of the urinary tract infections, you know. So I think that those things are particularly important. And then those who have kidney problems, say they've had kidney stones, you know, are obviously at far greater risk of having urinary tract infections because the stone acts as a nidus on which bacteria tend to collect. And they can grow larger and larger to form what we call infection stones. We also call them staghorn calculi. They're a different kind of stone than the ordinary kind of stones that people get. But that's for another time. So what would you like to focus on next?
I would like to focus on anything you would like to focus on.
Okay.
I'm not particular.
All right. Okay, so let's just take a moment to apprise everybody of the fact that not all urinary symptoms mean there's a urinary tract infection. So the common symptoms of urinary tract infections are burning, or pain, or having to go to the bathroom often. Now remember, we already said that having to go to the bathroom often can be many things. You know, it may be associated with incomplete bladder emptying, but if this is a new symptom, it may indicate that there's a urinary tract infection.
Now let me ask you this, does incontinence sometimes indicate an infection?
It can. Someone who's never had incontinence says,
that suddenly appears.
It suddenly appears, then it's worth looking. And also keep in mind that when we have all of these symptoms, what we have to do is we have to ascertain that there is an infection. Having said that, not all symptoms mean there is an infection, but sometimes we have no symptoms. Now, this is the other end of the spectrum. Symptoms, many symptoms versus no symptoms. And so a common example of this would be a family member from a continuing care patient at Garden Ridge who would call and say, you know, my mom doesn't look the same. She probably has an infection. And it's very common as we get older to have fewer symptoms because bladder sensation is reduced. And that may be one of the reasons why incontinence occurs, because people don't go timely, or there are urinary infections and they don't experience any symptoms. And so what we would do is we would do a urine analysis, look to see if it is abnormal, and then determine if or not there is an infection.
Are you actually culturing the urine to determine the bacterium?
So the first thing you have to do is you have to do a urine analysis. And if the urine analysis is negative, then you ought not to do a urine culture. We only do a urine culture if the urinalysis is abnormal. If it is normal, you do not do a culture. So then the question is, where are the symptoms coming from?
Right.
So one part of the anatomy, we spoke about the fact that we've got the bladder and the kidneys, but we have two kidneys about the size of my fists. Then we have ureters, which are these long tubes which bring us down to the bladder. And then before the bladder opens to the exterior, there's a short passage called the urethra. Okay, so inflammation of the urethra, inflammation as opposed to infection, can also cause symptoms. And those symptoms are often relieved by drinking plenty of water and sometimes requires the use of urinary antiseptics. But more of that later.
So just the inflammation of the urethra itself?
Okay. Yes, that can do it, or any of the passages there. So I think maybe next we'll just skip to how do urinary tract infections begin and talk about the risk factors. So normally, people are inclined to think that the urinary tract and the gut have bacteria in them. With the gut, yes. With the urinary tract, no. The urinary
Is that pretty
tract,
sterile?
The urinary tract is completely sterile.
Isn't that amazing? We don't think of any part of the body as being sterile.
Yeah, but it is. It is only as it becomes exteriorized that you begin to see bacteria. So many times we'll get a urine culture which will say 10,000 mixed urogenital flora. That's contamination from the exterior. That's not from the interior. Okay. And then generally when an infection is occurring, you see lots and lots of bacteria. So there is a bacterial count that we go by to guide us if this is a significant infection.
So it's types and numbers.
That is correct. That is correct. So how are these bacteria getting in if the urinary tract is sterile? We've used the word contamination many times. So, you know, dirty hands, not having good hand hygiene after having a bowel movement, or contamination after having a bowel movement, personal hygiene, all of these factor into how bacteria get introduced into the urinary tract. Or instrumentation, when a catheter is put in, when someone puts in a scope into the bladder. Catheters are a very serious risk factor for development of infections.
Believe it.
So we always try to get the catheters out as quickly as we can. And sometimes we can't, and then we have to put up with the consequences of urinary tract infections. You know, so another one of the factors we really wanted to emphasize are the risk factors, because if we know who is at risk, we can talk about prevention. So we talked about some of them already, so this will just reinforce what we said. Women need to be particularly careful. We need to ensure we drink enough fluids. We don't often do that, and the folks who live here are less particular about drinking fluids for reasons that we all know well. But it is important. Now, we've already touched on 3 other things which I think are good takeaways from today. If you don't empty your bladder fully, for whatever reason, use of incontinence products, and personal hygiene. So how frequently people shower is variable, but what should not be variable is how often people wash themselves. You can use a washcloth and a basin and, you know, clean yourself. And those who have...
And you're saying do it every day.
Oh yeah, there's no reason not to clean yourself every day.
You and I, in preparing for the program, talked a bit about the fact that Medicare over at Garden Ridge will only cover 2 showers a week.
That's correct. That's correct. So Medicare is trying to use a minimalist standard, and people can when, you know, people are in the hospital, they're not taking showers every day, but they're certainly using a wash basin, a washcloth, and some cleaners to clean themselves. And I don't see any reason why folks can't do it at home if they're not taking a shower. And when you do decide to bathe, a shower is good. A tub bath is not good. In my personal opinion, and the opinion of many others, in settings such as ours, there should be no tubs because they're a safety risk as well, in addition to more infections. We'll not dwell on the other 2 risk factors very much. Those who have kidney stones, we talked about that. And then if you don't empty your bladder fully, the urine is likely to change its pH and become more favorable for bacterial growth.
How can you be sure that you have emptied your bladder?
So as I said, when you have those symptoms, every 5 minutes, you've been to the bathroom, you're going again after 5 minutes, and then you're going again after 5 minutes. That's a good sign that you're not emptying it. You've got to discuss it with your physician. Okay. And then they've got to decide what needs to be done. Does a woman need a visit to the urogynecologist? Is an evaluation needed from the urologist? I would submit to you, we should not refer patients with urinary tract infections to urologists routinely. For women, we should not investigate until they've had 3 to 4 infections in 1 year, and in men, if they've had 1 or 2 infections. But routine urological visits and evaluations are unnecessary. They, in fact, can be harmful. So I do want to...
From a purely practical standpoint, simply staying on the toilet longer, is that helpful in terms of
Yes, that
emptying?
may help. That may help. If you think some people can take 7-8 minutes to empty their bladder, so after you think you've finished, just stay put, you know, and I recommend to many of my patients, slow count up to 100, and they tell me they're amazed that they can go again. But that's that 5 minutes, you know, you get up, you walk around, you have to go again.
That's such a simple kind of solution.
Yeah. So in the little bit of time we have left, and I think we have maybe just about 5 minutes or so now.
Yes.
Let's talk about two things. Let's first talk about prophylaxis in those who have recurrent urinary tract infections. Multiple infections, one bacteria, the other bacteria, we've looked, you have no blockage, but you're still getting the infections. What can we do? So after we've excluded any blockage to the urinary tract, we then want to put you on vitamin C to make your urine acidic to prevent bacterial growth. Okay? We usually like to give about 1 gram. The use of cranberry is very important. Now you can drink some cranberry juice or you can take a cranberry pill. Generally, I believe in the natural products, but you have to drink a lot of cranberry and
I
eat
didn't
a
know
lot.
there were cranberry pills.
Oh yes, there are. There's
Okay.
plenty of cranberry pills. So you can take those. Sometimes we want to use urinary antiseptics to be differentiated from antibiotics. It's like cleaning a surface versus actually using let's say you have a skin infection, looks a little red, you just clean it off with some alcohol, versus putting an antibiotic ointment. So we're talking about antiseptics. So there's many such around.
External.
No, these are pills.
These are pills.
These are pills.
Oh,
because this
okay.
is the urinary tract. You have to get something inside.
Okay,
that
all
won't
right.
work.
Oh.
To be differentiated from the personal hygiene part, which
How are those labeled? Are they over
they
the
have
counter?
names. No, they have to be prescribed.
Oh,
by
they're
a physician.
prescribed. Okay.
The other things to talk about, again, personal hygiene. Maintaining good bacteria in your body. A few weeks ago now, it would have been that we talked about the microbiome, keeping your
Right.
gut healthy.
Right.
Right? So yogurts are generally a good such source because they contain live bacteria. Even as you brought up to me, even after the milk is pasteurized is when the live bacteria are added. So probiotics are good. And I can't say enough about personal hygiene. It is one of the key factors in preventing urinary tract infections.
And I think we don't think about that often enough.
Yes, yes, absolutely. Sometimes the urologists like to give long-term suppressive antibiotics. Generally, we are not in favor of those because they can cause, other resistant bacteria to show up. So let's just talk about treatment quickly. Very easy. Find the bacteria, find out what will work for them, and treat them. So what that means generally is get a urine analysis, see if there are bacteria in there. You can use an educated guess and start the antibiotic before the culture, or you can wait for the culture and start the antibiotic after. That's a judgment call.
What length of time mostly for antibiotics with a urinary tract infection?
For the treatment? So there are various schools of thought here. If it looks like a simple cystitis, someone who's never had an infection before, you could give a single dose of an antibiotic, just ×1, that may be enough. Most of the time, people will tend to give it for about 3 days. If you think that it's a significant urinary tract infection, still a bladder infection, you might give it for 5 days. Sometimes we give them for longer periods of time. If people have had severe infections, we may treat them for 7 days and get a repeat culture while they're still on antibiotics. And then lastly, if you're diabetic, that would be one circumstance where we need to be particularly attentive because you have multiple risk factors because of abnormalities in blood sugar, immunity, and bladder emptying due to autonomic dysfunction. So I think that, our take-home messages from today are that urinary tract infections do cause a good bit of morbidity, that we have to pay particular attention to preventing them. And I'm reminded of an old Chinese proverb which says, good doctors prevent disease. Okay. Bad doctors treat disease. So I won't say any more. As much as we can prevent, it's good. So we've got good preventive strategies, and we should use those. Treatment for us is very easy, but to be aware that this is a common infection, which we should be aware of, I think goes a long way in treating it.
Yes. Yes. Well, Dr. Sethi, this has been extremely interesting and I think relevant to virtually everybody at some point in their lives.
I think so.
And as you're pointing out, as we get older, this is true with both men and women.
That is correct.
That we're at greater risk.
Yes.
I think this has been excellent. Thank you so much for all your words of wisdom here.